purpose of this video is to demonstrate communication strategies that foster trust, safety, and adherence within MOUD treatment. We will discuss motivational interviewing as one instrument of therapeutic communication. As you watch this video, we invite you to consider how this information informs or could improve your current practice. We will pause for reflection and analysis throughout this video and ask you to consider the accompanying questions.
Hey Randy, how can I help you?
I need to talk to the nurse.
Okay, I can go see if Tia is available. Can I let her know what's going on?
I need more Narcan. I need to talk to her, but I need more Narcan.
Okay, let me go and see if she's available. I'll be right back. Hey Tia.
Yeah.
Brandy's in the lobby. She looks a little distraught. She's asking for you.
Let's go see how we can support her.
Okay, perfect.
Randy,
Oh, hey.
how you doing?
It's not a good day.
Not a good day, okay. You want to talk about it?
Not out here.
All right, well, let's go back to our private spot and let's get some support for you.
The nurse Tia responds promptly and calmly, modeling de-escalation and emotional regulation. Before engaging, she takes an internal inventory of her own emotional state, demonstrating self-awareness and professional grounding, which are foundational to therapeutic presence. How do you respond when you see a client who's visibly dysregulated? What emotions come up for you?
Randy,
Hey.
how are you?
It's not great.
Okay, all right. Well, just to let you know, I do have another patient coming in 20 minutes, okay? So let's try to discover how I can support you today. Can you tell me about what's going on?
Here, the nurse uses clear, transparent boundaries, setting a framework for the interaction and helping build expectation and trust. The skill of therapeutic communication emphasizes collaboration and being upfront about time constraints, supports predictability and safety. Nurse Tia also chooses to use an open-ended question to start a conversation, a motivational interviewing technique that encourages involvement. Instead of assuming the problem, the nurse invites Randy to share her perspective, reinforcing client-centered engagement. How do your own stress levels or time pressures affect the way you show up in difficult encounters? What did you notice about nonverbal communication and positioning?
That's a lot. I don't know.
Well, last time you came in, you began the program. How is that going?
It's fine, I guess. I need more Narcan.
Narcan, okay. Did you use the last dose that we gave you?
I think so.
You think so? All right, can you kind of tell me what you remember? Or?
My friend was having this party, and it got kind of wild, and I woke up in the ER. And maybe my friends used Narcan on me. The nurses didn't tell me anything. She was totally rude to me. And I hear out in the hallway talking to another nurse about me like I can't hear them out there.
Oh, that sounds like a very bad experience.
Yeah, it was. Like I was there for so long. No one told me anything. And then they're like, you're discharged. I'm like, I'm homeless and they don't care. And when I get back to where I'm camped, like my Narcan's not there. I don't know where my Suboxone is. Like I'm freaking out. Like I don't want to overdose again.
An emergency room can be a very nerve-wracking place to go. So just know that you did the right thing by coming here.
As Tia listens to the client, she models empathetic validation. She acknowledges the emotional impact of the client's story without minimizing or problem-solving prematurely. After the client shares her story, Tia reflects on and summarizes what has just been shared. These responses demonstrate deep listening and help to organize and validate the client's experience. Tia also reinforces dignity by honoring the client's perspective and resisting the righting reflex or wanting to fix the client or her story. Finally, Tia offers affirmation, allowing Randy to see that she is not alone in these feelings. She reaffirms Randy's resilience and effort, strengthening self-efficacy, a key mechanism of change in motivational interviewing. What is the difference between fixing a problem and supporting someone through change? How did affirmations influence the client's willingness to continue engaging?
What we're going to do today, we're going to meet with Dr. Chu. We're going to get you another prescription for Suboxone. We're going to provide you as much Narcan as you're needing, okay, to prevent any sense of overdose.
How might this interaction have gone differently if the nurse had responded with judgment or urgency?
And are there any other steps today that you feel would help your situation?
So last time we talked about therapy, but I've done therapy before and it doesn't work for me.
All right. Can you tell me what were the parts that didn't work for you?
Yeah, like she didn't get it at all. She just tells me to quit using drugs. Like it's that easy. Like she didn't help me figure anything out.
Okay, so it sounds like you're looking for someone that better understands your situation. You're feeling that that person didn't truly connect with you because they had no understanding of substance use disorder or any of the, the situations that come along with substance use disorder. Do you have anybody in your life that might have walked in your shoes or lived your life experiences?
No, I do have this cousin. He quit drugs like 5 years ago, I think. So, he might have some good advice or at least know what I'm talking about when I tell him what I'm going through.
Do you have their phone number?
I'm sure I can find it.
Okay. Well, the next time you come in for a visit, would that be a good opportunity for you and I to discuss kind of how it went?
Yeah, sure.
Here we see change talk. The client identifies a concrete action aligned with recovery. The nurse reinforces this by exploring logistics and strengthening the client's commitment to their goal. Where did you hear change talk from Randy? How did the nurse support autonomy rather than directing or persuading? Instead of persuading or correcting, the nurse explores ambivalence using open-ended questions and reflections. This honors Randy's lived experience while also deepening rapport. Additionally, Tia elicits Randy's values and preferences, a core motivational interviewing strategy called evoking. Rather than prescribing solutions, she draws out the client's own criteria for support. Nurse Tia also supports Randy in identifying a small, achievable goal on the path to her larger therapeutic goal.
So, I just want to say I'm proud of you for coming in. I'm proud of you for, making the decision to come in and stay connected, okay? So every day is going to be a challenge. So what we're going to do is we're going to continue to support you and have discussions each time you come in, and we'll try to make your goals small goals so that you can meet those goals. Okay?
Thanks, Tia.
You got it.
How does supporting harm reduction differ from enabling substance use? Thank you for your commitment to making a difference in the lives of people across New Mexico.